You with Healthbeat, Bigisisa's monthly television show. I'm Mia Malan. It's been 8 years since the mental health scandal that has now become known as the Life Esidimeni tragedy, during which more than 140 mental health patients died in state care.
Thank you, Judge.
Earlier this month, judgment was handed down in an inquest into the deaths of the Life Esidimeni patients. The inquest found there's now enough evidence to prosecute two top former Gauteng health officials.
I have come to the conclusion that the deaths were negligently caused by the conduct of Ms. Dorothy Gatani Mahlanga and Dr. Mahabo Manamela.
The move was in line with a policy to move mental health patients out of hospitals to community organizations. But it was badly done by the Gauteng government, and many patients weren't suitable for community care. So how can we ensure that lessons have been learned from Life Esidimeni? Our team went out to Hammanskraal, north of Pretoria, to find out how community care organizations are coping and what support they receive.
Lebo, wearing a yellow hoodie, turns 22 today. But he's not aware that it's his birthday. Cerebral palsy has trapped him in this chair forever. But at the Boikanyo Disability and Children's Center in Hammanskraal, he gets the kind of care his parents cannot give him. Boikanyo means commitment, and there's plenty of that around here.
The reason why we established this kind of the center is because of we saw a lot of children struggling, and there were parents, some they don't care, some they just lack knowledge.
Johanna Maphara founded Boikanyo in 2004 with a handful of children. 2 decades later, the center is home to 25 children and adults with mental disabilities.
So we are handling children living with autism, Down syndrome, cerebral palsy.
Kutlwano Rakabe has been trained by the Education Department to monitor the learning programs at Boikanyo.
It's important for them to also feel like they belong, they are normal, and they're able to do things with their own abilities. Because remember, these children are special.
There's a daily program for residents here. The aim is to develop them to their full potential.
So we have 3 different classes here in Boikanyo. In the interactive class is the learners who can do anything for themselves, who requires less support. And then we have the awareness children, is the children who cannot do anything for themselves. They require hand-to-hand support mostly. And then we have the transitional. The transitional class is for learners who they don't concentrate for long.
The community's needs far exceed Boikanyo's capacity. And Johanna wishes she could help more children. Daisy Boshomani is one of the mothers in Hammanskraal who would love to have a place like Boikanyo for her 10-year-old son who has cerebral palsy. He's been on the waiting list for a special needs day school for 2 years.
Boikanyo, it's a center that we most mothers prefer in Hammanskraal. The problem with Boikanyo, it's a small space. It's already full. They take certain number of kids for them to, and it's a residential. It's not a day school where you can take your child in the morning and the child comes back in the evening.
Lebo is one of the lucky ones. Usually residents have to go elsewhere when they turn 18.
We start children while they are still young. Then they bond with us. We do everything. So it's difficult for us to take them out. So the main problem is that our center, it doesn't have enough rooms to cater for them.
They're trying to raise funds to build an adult center to serve the community of Hammanskraal.
For more on South Africa's mental health policy and what should change, I spoke to Leslie Robertson of the South African Society of Psychiatrists. Leslie, thanks for your time. We saw in the insert now that in the case of the Boyekanyo Mentally Disabled Children's Centre project, that community-based mental health care works pretty well there. And how do you decide who is suitable for community-based care?
That decision is often made because of the severity of the illness, of the severity of the disability, and it's made in conjunction with whoever has brought them into care. Might be a family member, might be somebody else, sometimes it's social workers. There's a careful assessment made that this person needs that kind of care, at least for a period of time, and some of them for life.
What is it in that type of care that a hospital can give them that a community organization can't give them?
So they've got food, shelter, constant companionship, supervision. There's people regulating certain behavioral issues, impulsivity, violent and aggressive behavior. There's nursing staff around. A major difference is the safety and security that they have, and that people are trained, personnel, not to react, for example, how to de-escalate problems.
But community-based mental health care is a policy that's endorsed by the World Health Organization, and it's an official policy of our National Health Department. Why? What are the advantages of community care?
Because it is the best way, or believed to be the best way, to achieve a person-centered care approach. But the community needs to understand what they have to do. There has to be capacitated. So it really does work in line with our rights of persons with disabilities and the UN Convention that the environment has to adapt to the person's disability. We can only do so much through medicines or through medical care. But that environment needs training, it needs education, it needs resources, they need to be capacitated in the NGO and the surrounding community.
So until we have the ability to also get communities and have enough capacity to get communities to support these projects, it's not going to work that well, right?
Yeah, that's that. But we have to do it, and we are doing it. And there's actually a lot of NGOs like Boyekanyo. We do have a major problem when children with special needs grow up to be adults, because we don't have enough NGOs to support adults with severe neurological conditions like cerebral palsy. I think the community is becoming more aware, but absolutely we have got to get ordinary citizens who are going about their daily lives to have some awareness of people with mental disabilities living in their community.
Leslie Robertson, thanks very much for your time. After the break, should Gauteng health officials responsible for the Life Esidimeni disaster go to jail? You with Healthbeat? I'm Mia Malan. Earlier this month, the inquest into the deaths of former Life Esidimeni mental health patients found that two former top Gauteng health officials, the former Health MEC Kudani Mahlangu and the former Director for Mental Health, Makgabo Manamela, could be held responsible for the deaths of at least 9 of the patients. The public interest law group Section 27 represented a lot of the families in their struggle for justice. With me is Section 27 Executive Director and Attorney, Sasha Stevenson. Sasha, it's been 8 years in the struggle for justice, and we've seen a health ombudsman investigation, there's been arbitration hearings, and now there's the inquest. And in none of these events, we saw people like Mahlangu or Dr. Manamela take responsibility for what they did. What is it with accountability and government officials?
What's clear is from this inquest is that accountability is needed and in fact can be found. And so it's been a very frustrating 8 years where the people who are responsible and should be accountable for this disaster haven't been taking responsibility, and hopefully now that has ended.
Now it's up to the National Prosecuting Authority to decide whether they're going to use this inquest finding to open a criminal case against these former officials. Do you think they're going to do that?
We've got 56,000 pages of evidence. Testimony from witnesses, we have police files, we have medical records, we have autopsy reports, and we've heard from people who were implicated and from people who were affected, as well as from forensic pathologists and other experts. So there's a lot of evidence there, and what the court has found is that on the face of it, there's a case for prosecution against 2 people. The NPA has everything it needs now, and I trust that they will institute a prosecution in this case that is really one of the worst examples of human rights violations in democratic South Africa.
The inquest took a few years, right?
A disaster of this scale is very unusual. And so yes, it did take a very long time. And this has been a long, long road to justice for families and for everyone else who's been watching this in horror. We have no idea how long the prosecution is likely to take, but our clients are anxious to see it happen. They're anxious to see criminal justice, and we hope that the inquest will open the door to that justice.
Do you think they deserve to go to jail?
I do.
Why?
Former MEC Mahlangu made a decision to terminate the contract with Life Esidimeni. She then pursued implementation of that decision despite countless warnings from experts, from family members, from people within the department and outside of the department. There were then further warnings after the contract was terminated. And then Dr. Manamela was de facto in charge of this project. She was the one who developed the project plan. She was the one who was pushing implementation. So those are 2 people whose actions and omissions and decisions directly led, as the judge found, to the deaths of at least 9 mental health care users. And for that, they should be held to account.
From the way in which the Gauteng government conducts itself today, do you think they've learned their lessons from Life Esidimeni?
There are still serious weaknesses in the mental health care system in Gauteng and in the rest of the country. There's still underinvestment in mental health, and importantly, there's underinvestment in community-based mental health. Even outside the Gauteng Department of Health, there are big holdups with providing the kind of funding to NPOs that government is responsible for. So we've had a disaster recently where the Department of Social Development decided to delay payment to NPOs caring for various vulnerable people, children, people with disabilities, people who are homeless. DSD decided to do that ostensibly because they wanted to investigate potential fraud. They were concerned that people within DSD were colluding with people within NPOs, which certainly must be dealt with. But what it resulted in was massive delays in the payment of subsidies across to NPOs, and in some cases, the non-payment of subsidies. And that again puts vulnerable people at risk. And so I am worried that there hasn't been the kind of lessons learned from the Life Esidimeni disaster that should have been learned.
Sasha Stevenson, thanks very much for sharing your time and also your insights today.
Thank you.
We asked the Gauteng government who's been paying the legal costs for those officials held responsible for the Life Esidimeni tragedy. Vuyo, thanks for your time. Is the government paying for officials such as Tridani Mahlangu or Makgoba Manamela's legal costs?
Yes, indeed. They are paying for those butler costs because first they were not criminally charged, but also they were subpoenaed to provide evidence for the inquest to arrive at the findings.
And is this for everyone? So also, for instance, for Barney Salabano, the previous head of the Gauteng Health Department?
It will have been basically everyone, because really what we wanted out of that is to get the information and to make sure that the information is available without hindrance so that we can really get to the bottom of what really happened during that fateful event.
Are you guys ashamed of the conduct of your officials during this tragedy?
Well, we really regret of what has really happened to the residents of Gauteng, the people of the country, and I think it was a very sad moment, a very, very bad situation for the people of Gauteng. So yes, you can quite actually sum it up to be a shame, but I think there's much more deeper, really waiting for what really happened there, because that will obviously prompt all the civil servants to act with care and to make sure that whatever that we do collectively, the life of our people are in the center of our activities.
Vuyo, thanks for your time today.
Thank you very much for having me.
After the break, how a young Soweto resident has overcome stigma to cope with her depression. Stigma makes people reluctant to seek help for mental health problems. And a shortage of psychiatric services at public hospitals doesn't help either. Our team caught up with a 25-year-old Soweto resident who, after years of depression, has learned to manage her suicidal thoughts.
Bonolo Libudu from Mapetla, Soweto was 15 when she first experienced depression.
My clinical diagnosis was major depression, and that was back in 2014. I was going through a lot of distress because I had confirmed that I was actually raped when I was 5.
After several suicide attempts and self-harming, Bonolo sought help from her local clinic, where she remained on the waiting list for months.
I did not know how to cope, so I continued with the self-harming, with overdosing on pills.
Eventually, she was allocated a psychologist, but this came with challenges.
It was a struggle because they would change psychologists.
On days she managed to get to the clinic, she received no sympathy from staff.
Where a nurse asked, "What are those things on your hands? Why are you trying to kill yourself?" And then the other nurse was like, "I know these kids, the things that they do lately. Yeah, you just need to go to church."
At 17, Bonolo was raped by an ex-boyfriend, even though she'd confided in him about her childhood rape. This pushed her to another suicide attempt.
I just remember how hurt my family members were, how my grandmother was hurt, how she expressed how losing me would completely destroy her.
Since leaving the public healthcare system, Bonolo has been counseled for free by the organization Heal SA.
I cannot talk about my mental health journey without mentioning services like Heal SA, because honestly, what do you do when you feel like killing yourself and you have to wait for a call saying a psychologist is available?
Bonolo says journaling and exercising help her cope with her depression.
So I started journaling, I started exercising. I'm okay.
With me is Mpadi Makgalu, the founder and CEO of Heal South Africa, where Bonolo found help. Mpali, welcome. Thanks for your time today. Why did you start Heal SA?
Heal SA was started at the height of COVID, and it was informed by my own personal journey. I was really concerned about the well-being of people who can afford mental health services, and that's how I started Heal SA. We offer free mental health support online. You can call us Monday to Friday from 8 o'clock until 9 o'clock in the evening.
And we've seen in this insert Bonolo, who got help from you, but she waited for very long for help from a government facility. Is this your experience?
Yes, I think we get that a lot. I think when we speak to people and we tell them this is a free mental health service, the first question they ask us, how long will I wait to get the service? And when we say it's an immediate support, we have 24 hours waiting period. So if you call us and all of our therapists are busy, we can guarantee you that within 24 hours, one of our therapists will get back to you.
Why can you guarantee that? Where do you get the resources from? How many people do you employ?
I self-funded Heal SA from the beginning. For the first 2 years of Heal SA, it was funding from my own savings. As I left corporate, then I ventured on this very much needed service. And we were very fortunate. In 2023, we received funding from World and a global network for young people with disability, and that has been a game changer. We are now able to support at least 100 people per day, where we have about 10 therapists, and we also get support from volunteers, psychologists or social workers.
These psychologists, are they working online at a call center, or do they also do in-person work?
We do have both. The main service provision is the dedicated line. But when we get to the high schools that we serve and to the universities, if students want to have a one-on-one with a counselor, they can do so.
So I would imagine you would also sometimes have to refer your patients to government hospitals.
Oh, yes.
Do they get helped quicker because you give them a referral letter?
Oh no, especially during exam time, that's when you realize that, yeah, we have problems, because the client students that we serve, they would say, but I've been to the hospital, I've waited, and I'm still not able to get support. And it's a bit frustrating for us because we do not have the capacity to help them beyond the counseling that we offer online.
What do you think needs to change?
Oh my goodness. I think first of all, we need to talk to stigma. Our communities are still not recognizing that mental health is a serious issue. I think we need to talk to government. The fact that we only spend 5% of our health budget on mental health, and 3.5% of that goes to hospitals to help people with mental health issues, but they do not understand that these same people have to come back to the community and integrate. What services are there to support me going forward?
You were also among a delegation who counseled the teachers at a school in Tembisa where there were suicides earlier this year. Yes. How do you help teachers to cope with it?
What we see in schools is what's happening in communities. First of all, we are not having the right conversations around mental health. You talk to educators who also are not even aware of their own mental health.
If you need help, guys, don't hesitate to talk.
For me, being at Eklinisweni school, I just realized a lot more work has to be done in terms of just getting out of the crisis responsive mode and really getting our communities, our schools, and our families to actually start having the heavy conversation around mental health, what it is and what it's not.
Mpadi Makgalu, thanks very much for your time today.
Thank you for having me.
In June, we broadcast the plight of the Freedom Recovery Centre near Nigel, which was forced to close its doors after the Gauteng government stopped paying its subsidy. 4 days after our story went out, the subsidy was reinstated and residents are now back at the centre.
You guys were so amazing. In times that we felt that, there's just no hope left. You carried us. Thank you, thank you, thank you, thank you.
That shows how change can happen if civil society and the media work together. That's our July show. Stay well. Goodbye.